Hi, I'm Dr. Trace Curry. Welcome to our Orbera information video. Obesity has increased greatly in prevalence in the United States over the last 20 years, as you can see in the graph here. So it's exciting to have a new treatment for patients that can bridge the gap between medical weight loss and surgical weight loss. Obesity contributes significantly to social bias and discrimination, and in addition, it places a burden on our healthcare system of nearly $150 billion per year. In addition to increased costs to the healthcare system, there are significant personal economic costs as well, as many popular diet programs can cost $2,500 to $3,000 and more per year. Until now, there's been a significant gap in the treatment of obesity in the United States, as patients were only offered a less powerful method such as diet and exercise or possibly weight loss pills, or they had to make a significant jump to a surgical weight loss option that carries significantly more risk. But now, with the approval of the gastric balloon in the United States, patients do have that lower risk option in terms of an incisionless procedure that is non-surgical that can really help patients get the edge on their weight loss and that boost that they need to get the scale moving in the right direction. And I'm very proud to have placed one of the first Orbera gastric balloons in the United States shortly after FDA approval in August of 2015. So what is the Orbera system? It's much more than just a device. It's a two-part process that involves implantation of the gastric balloon and meeting with our support team of experts for a period of 6 months while the balloon is in. And then after the balloon is removed, the program continues for another 6 months of very intensive monitoring to help patients make sure they keep the weight off. How does Orbera work? It's a pretty simple concept. It's placed into the stomach and then filled with saline. And once it's filled, it takes up roughly about 1/3 to 1/2 of the space of your stomach. So this will help you eat significantly smaller meals while still being full. So it will be much easier to stick to whatever diet you're on. And in the initial clinical trials in the United States, patients who received Orbera lost 3.1 times more weight than the group that were treated with medical weight loss alone. As I mentioned in the last slide, patients can expect to lose about 3 times more weight with the balloon than they would on a diet without the balloon. So you're going to see real results pretty quickly. And our goal is for patients to lose at least 25 to 50 pounds in the first 6 months after placement of the balloon. So let's take a look at how the balloon is placed. As I mentioned, it's a non-surgical procedure involving a mild sedative in which the balloon is guided down into the stomach with a scope, and then the balloon is inflated to about 600 cc's of saline. The balloon is left in place, filling the stomach, so you're going to get full earlier while it's there. After a period of 6 months, the balloon has to be removed, so we'll sedate you again, look down at the balloon with a scope. There's a special catheter that we can puncture the scope with. Then we simply evacuate the saline and pull the balloon out. The procedure takes roughly about 20 to 30 minutes, and patients are home the same day after the procedure. Although many patients can expect to return to work the following day, some patients will have significant issues within the first week as far as nausea and vomiting. This is simply your stomach getting used to having the balloon inside there, and we will prescribe several different medications to help address the symptoms of this issue. It's important to point out that the balloon can't do all the work for you. The patient has to make significant commitment to changing their diet and regular exercise, and also to come in for their office appointments with our dietitians so that they can coach you in the right methods to lose the maximum amount of weight and keep that weight off long term. Our team will be working with you for a total of 12 months, so we will reinforce proper portion control and lifestyle changes that will be necessary to keep this weight off. In addition, our practice has extensive experience with state-of-the-art weight loss medications that we can utilize along with the balloon to really enhance your results. Sometimes patients are reluctant to sign up for a new procedure, but it should be encouraging to know that Orbera has been around outside the United States for more than 20 years, and over 200,000 Orberas have been implanted worldwide. We have one of the most experienced teams in the country in managing weight loss patients, and we can work with you to help you change your life. We offer 24/7 support to our patients, especially through that first week, since you may have some issues with nausea and vomiting. And as I mentioned in the past slide, you get 12 months of aftercare support with monthly dietary visits. We have offices in Cincinnati, Northern Kentucky, Columbus, and Dayton, and we can offer virtual visits if you live out of town. Gastric balloons are not covered by insurance in the United States, but we do have an attractive self-pay price of $6,500, which includes balloon placement and removal, 12 months of aftercare, and 24/7 access to our team. We partner with Prosper Healthcare Lending to offer low-cost financing options for our patients. There's a simple online application process which you can find on our website at loseweightcincy.com. Just go there and click on Financing Options, and you can fill out an application online and usually get an answer back on your loan status within minutes. Even though Orbera does not require surgery or any incisions, it's not for all patients. To qualify for Orbera, you must be an adult, you must have a body mass index of 30 to 40, and you must be willing to participate in a medically supervised program. We are able to offer Orbera to patients with a BMI over 40, however this does lie outside the FDA indications for the approval of the balloon, so this would be considered an off-label use. The Orbera Advantage offers you a non-surgical procedure that is proven to deliver better weight loss than with diet and exercise alone. The gastric balloon will help you eat smaller meals and learn proper portion control. You'll be supported by a team of medical experts, and they will help you learn the eating habits and lifestyle changes needed for long-term success. If you'd like to learn more about gastric balloons and the Orbera system, there are 2 ways to contact us. Simply call one of the numbers on the screen or go to our website at loseweightcincy.com and request an appointment. I'm Dr. Trace Curry, and I look forward to meeting you soon.